Dr. Stefanie Carnes. I am the president of the International Institute for Trauma and Addiction Professionals. We are an institute that trains therapists on how to work with sex addicts and their loved ones. And our mission at IITAP is to get compassionate and effective treatment for sex addicts and their families. And this is very important and near and dear to our hearts. And so today I'm going to be talking about disclosure and the process of disclosure. I recently completed a research study, and in that study I learned a lot about what's effective, what's not effective with disclosures. And I'm providing this video to just provide some information to clients that are moving towards the disclosure process and are considering disclosure in terms of what to expect, what things are important to be considered as they're moving towards the disclosure process, and how to best prepare themselves. So this is obviously a very difficult and traumatic time for most couples that are working on this issue. Sex addiction is devastating for families and very difficult for partners to understand. And partners really oftentimes want the truth about what the addictive behaviors that the addict has been participating in. They want to be empowered with the truth so that they can make healthy choices for themselves based on the truth. And that's really what the disclosure process is designed to do. It's also important for the addict so that they can get honest and live a congruent public and private life, get honest in their recovery. Honesty is a really important component of the recovery process. And so it really, for them, is part of their recovery and also really facilitates the letting go of shame and secrets in their lives. And disclosure can be, while it's very difficult for couples and families, it can actually really be the first step towards healing a coupleship, because everything needs to get out on the table so that the partner can really understand what's been going on, and so that they can start working towards healing. And so while it's not easy, it is an important part of the healing process. So you might be wondering, is this the right thing for us to be doing? A lot of people have wondered that in the past. And there has been two research studies, my own, and then one that was done many years ago, back in 2002, by Jennifer Schneider, Deb Corley, and Richard Irons. And they basically asked couples going into the disclosure process, do you think this is the right thing to do? And then after the disclosure process, they said, do you think that that was the right thing to do? And what they found was, even though there was some ambivalence about it going into the disclosure process, in their study they found that 96% of the time, after couples went through the disclosure process, they felt like it was the right thing to do. Now, they studied 80 couples in their study. I had 137 participants in my research study, and my percentages were almost the same. What I found was about 94% of people that had been through disclosure afterwards felt like it was the right thing to do. So, it is difficult. We recommend that, one of the other things that we found in research is that it can be quite traumatic for partners. Sometimes it can be a lot of information. In some disclosures, there's a lot of information. In some disclosures, it's just a little information, but still it can be very painful. And in one study, a study that was done by Barbara Steffens and Rennie, they found that when partners learned about the sex addict's behavior, about 70% of partners had symptoms of post-traumatic stress disorder and acute stress disorder. So it can be very stressful, and a lot of times partners don't realize going into it how stressful that can be. So our recommendation is to really get in a lot of supportive care and do a lot of preparation just to make sure that you're really supported going into the disclosure process. And so we only recommend disclosure be done for couples who are committed to one another. That's one important thing. One of the findings in my study was that the people that were not really committed to the relationship weren't entirely sure that they wanted to continue with the relationship. those participants had more partner trauma and more damage to their marriage after the disclosure session, statistically. So really, it's really geared towards couples who are committed. And the idea is that it's really supposed to repair the relationship. And the idea is that we're going to get all the information out on the table so there's no more secrets, and so that the couple can move forward. So for this process, we recommend a facilitated disclosure. I recommend you find certified sex addiction therapists, because certified therapists have extensive training and have participated in supervision around disclosure. So that's really important, because this can be a process that can be distressing, and you want to have the most well-equipped therapist that you can possibly have. And so that's really important. And so we recommend that for the disclosure process, the addict has their own therapist, the partner has their own therapist, and then at some point in time, you as a couple also engage in couples therapy for the repair of the relationship. That's a really important aspect of this process. And so the idea with facilitated disclosure is that the disclosure is really prepared for. There's a lot of thought that goes into preparing it to make it as least traumatic to the partner as possible. This is already hard to hear, and so we really want to get both parties ready so that the partner, it makes it a difficult situation a little bit easier. And so your therapist will do things to prepare you, like make a plan, get support people in your life, hopefully get you in a group of people that have perhaps experienced similar things that you have experienced. So they will also probably make a whole support plan for the week for you, such as having multiple sessions that week, having a support session right after the disclosure session, perhaps sending the kids away for the week to be with grandma and grandpa, having things like some trauma therapy and set up, some massage, some support of some meetings with your best friends, and support people throughout the week so that you have some support in place during that time, so you're not alone and you feel supported during the process. The addict tends to put a lot of work into getting ready for the disclosure, and it's really important that the addict does have this work and is involved in the recovery process. One of the findings of my research study was that addicts that were involved in the 12-step process, in a comprehensive treatment process that included some trauma work, actually had disclosures that were more effective and less traumatic for partners. And so having them, it's important that they're engaged in recovery, following their treatment plan, and there's some important pieces of work that they need to do gearing up for the disclosure. So usually the addict and their therapist will spend a lot of time reviewing the addict's history of their behavior, doing things like a first step, a timeline, compiling all of that information. It takes some processing for the addict to compile the information in a concise and effective way. And during a disclosure that's facilitated by therapists, the therapist really is going to guide the addict in making the disclosure, the information in the disclosure, very appropriate sharing for the partner. So there's going to be sharing clear, factual information about all the behaviors that isn't going to leave the partner guessing about about what the addict has been doing. So things like what the addict has been engaging in, the type of behavior, if it was actual intercourse or not, was it protected, unprotected, if there's any health issues, that will be included. All of the information will be laid out in clinical terms. It will not include jargon. It will not include details that will be painful for the partner. It will not include names of acting out partners, unnecessary information. It's all going to be clear, factual information. So, for example, something like, I went to strip clubs about 10 times a month between January and September of 2017, and that included objectifying women and lap dances. So that kind of information. Or I engaged in a sexual and emotional affair with Suzanne at work that included genital protected intercourse. So that kind of very clear factual information that doesn't leave the partner guessing. Now, you might have noticed I just included the name of a person. So the name of the acting out partner is included if the partner knows that person or will run into them. And that's just out of respect for the partner, so that they know if there's people in their lives that they know and are going to be interacting with that have been involved in the acting out. So that's the type of information, and really the disclosure session itself is geared towards just really getting that information out and allowing the opportunity for the partner to ask questions and get ask clarifying questions. And one of the things in the findings of my study that came out is that the best disclosures, the ones that were rated as most effective, the partner was they were empowered to be able to ask questions. So the addicts should anticipate that the partner will be able to ask any questions that they feel are important to help clarify any confusion that they might have for them. Oftentimes in the preparation, the partner is asked what is important to them to know. And so the therapist will be sure to try and include that on the disclosure document so that hopefully most of the information that the partner needs is on there. Now, partners will be discouraged to ask for details. Now, if it's a detail, when partners are wanting a specific piece of information, I'll often ask them why that's important to them. And if there's a piece of information that is helping them make sense out of something, then and it's a detail, then I'll usually ask that be incorporated. Sometimes as a result of the betrayal trauma, partners do want more detailed information, and I often, if I'm working with a partner, I'll often discourage them from asking information that's kind of unnecessary details that might just kind of rent space in their head and just cause them more pain and trauma. And so if I'm the partner's therapist, I'm advocating for them to get clear factual information that doesn't include that kind of detail that's going to be unnecessarily painful for them. And so both parties should be going into a disclosure with feeling supported and with a plan for the week. That's really very important. So preparation for both parties is essential. Now, one of the things that you'll find is that the disclosures are typically very structured. So your therapist will provide, there's lots of different structures that therapists use, but your therapist should be able to brief you ahead of time on the structure that they're going to provide. Some therapists will ask the partners to hold their questions throughout the session. Sometimes this helps, feels respectful to the addict in their sharing. It also gives the partner the opportunity to write down their questions, hear everything, and sometimes converse with their therapist before coming back and asking for questions. Other therapists will pause throughout the disclosure and have the partner ask questions as they go along. So there's some different stylistic things, but your therapist should be able to brief you on sort of what the guidelines are and what the structure of the session is going to be. One of the things is to keep in mind is that you can stop the session at any time. If you're overwhelmed, ask for what you need from the therapists. There's no rigid format that has to be used. So you as the client, your needs are of utmost importance during this process, and therapists will work hard to cater the process to meet your needs. Now, disclosures, obviously the partner gets a lot of information during that session, and then afterwards, usually there's a debriefing process where the partner will meet with their therapist. The addict will also meet with their therapist in group and get support. That's not uncommon. And oftentimes then the partner will be asked to share with the addict how that impacted them and do what we call an impact letter. Now, sometimes the impact letter can be, right away, just in terms of what has the impact of this disclosure been on you, and ask the partner to respond. And then you go into some of the emotional processing and some of the healing therapy that comes as the next step of treatment. Other times the partners may not be ready right away to do an impact letter. They need to take some time to put their impact letter together. But basically the idea of the impact letter is for partners to be able to share with the addict really what this has been like for them, how painful this has been for them, what feelings, what their thoughts and feelings are now that they've learned about the behaviors that the addict has been involved in. So they get the opportunity to kind of share their perspective and their pain with the addict. And that's a really important thing for the addict to hear and really understand, so that they can understand what the partner's experience of all of that is. And one of the things that came out of my research study is when the partners were able to write that impact letter, that those disclosures were rated as more effective and also less damaging to the marriage. So it is a really important part of the healing process to do that, for partners to be able to do that impact letter. So that's really critical. So it's very important to remember that disclosure is just the beginning of the healing process. After disclosure, it needs to be followed up with intensive couples therapy to work on repair for the relationship. Oftentimes the addicts will also do an exercise. A common one is called emotional restitution, where they write a letter to the partner that really documents how they get it, they understand how they've hurt the partner, and then they go into more in-depth couples therapy to try and repair sort of the wound around the betrayal. And so intensive couples therapy is really important to follow up with. But I would also say that it's important for partners to get their own trauma work, and for them, and it's not just being supported by a CSAT and a group, hopefully, but to actually do some trauma work like EMDR, eye movement desensitization reprocessing, or somatic experiencing, or some of the other wonderful trauma treatment methods that are out there, to really do some of their own trauma work, because this is very difficult for partners. And a lot of times partners will say, well, the addict's the one that needs the treatment, he's the one with the addiction, and so they'll kind of think we only have a limited amount of resources, so we'll put it towards that. But I really encourage partners to not underestimate their needs also as family members. This is very difficult, and so they deserve to get treatment, they deserve to have trauma treatment as well, so resources should be shared, and partners should also be able to get treatment as well. And so disclosure is not just, this is just the beginning of the healing process. And so it's important that people look at the long term. We often look at recovery for sex addiction to be a 3 to 5 year process. And obviously it's much more intense at first. And early on, oftentimes the focus is on the individual recoveries of both the partner and the addict, and then you have disclosure, and then oftentimes the couples therapy becomes a big focus of treatment. And so we're always trying to keep in mind the needs of the whole family, and that this is a long-term process. and we hope for the addict that recovery becomes a lifestyle for them. So I'm going to share with you just a couple quotes from a couple participants in my research study that have gone through disclosure, so you can hear a little bit from their own words. The first one says, "It has been 6 years since my disclosure, and this process allowed me to make informed decisions about moving forward with my life. Until that point, I felt stuck. The truth set me free. My marriage lasted 2.5 years after treatment, but ended well as I had very clear boundaries and knew what behaviors were part of my partner's recovery or not. We've been able to remain friends and have moved on. I will be forever grateful for disclosure as it freed me from the what ifs." And another partner shared, "This was the best thing ever for my own recovery. It gave me all the facts I needed to connect the dots and understand that my instincts were always correct. I trust my instincts fully ever since this process and never question my gut feelings as I know them to be a true compass. I was able to make informed decisions on what to do about my relationship and marriage going forward and was grateful for the truth. Not having a disclosure, no matter how painful, would have left me wondering for years to come and doubting my decisions and impeding my own recovery." So even if a couple doesn't end up staying together, oftentimes disclosure can be the right thing for both parties, the addict in their recovery and the partner in their own healing process. Our hope is, of course, that the couple stay together, but being able to have the facts is important, and it's really important for partners to be able to sort of reclaim their reality around what happened during the deception of the sex addiction. So I know this can be a scary time moving towards disclosure, and that can be very anxiety provoking, but hopefully with the guidance of good therapists, you'll be among the 96% that feel like it was, in hindsight, the right thing to do. So I hope that this video has provided you with some good information, and thank you for watching.